Katavi, Western Tanzania. A national vaccination program is taking place to deliver immunizations against measles, rotavirus, and other infectious diseases that pose a threat of a widespread outbreak.
Ugonjwa wa surua ambao ulitukumba katika wilaya yetu ya Mpanda, na tumeweza kuwachanja watoto kwa sababu tunajua watoto ndio taifa letu la kesho.
The success of immunization programs like those seen in Katavi and many distant areas of Tanzania has not been without its share of difficulties. In the peak of the COVID-19 health emergency, as the world was focused on vaccinating against the virus, Tanzania found itself struggling with one of the lowest vaccination rates in the world. And not just for COVID-19, but for other routine immunization programs.
Due to some of the problems, which including local beliefs, and some we are trying to tell people some other ways which are not good, trying to discourage people to do vaccination.
There were reasons for the initial low vaccination rate in Tanzania, as was the case in a number of African countries.
The reason for vaccine being low acceptance, there was no enough time to prepare the community, because that was the pandemic, you remember. So during the hurry, we had not prepared the community adequately.
Vaccination hesitancy and misinformation cast a shadow of doubt over the efficacy and safety of vaccines. To add to the challenge, accessing vaccines was also a daunting task.
On the one hand, tests created at lightning speed and vaccines developed in record times. And on the other, a lack of preparation. The vulnerable hit the hardest, and vaccines hoarded by many countries as people in poorer nations went without. The impacts remain unequal to this day.
The pandemic had disrupted global supply chains, making it nearly impossible for African countries to secure the life-saving doses. In the event of availability, the next challenge was addressing the delivery and administration of vaccines to communities. The lack of adequate cold chain delivery capacity and storage facilities for vaccines posed a significant challenge to the effectiveness of immunization programs in Africa. The COVID-19 pandemic accentuated the cold chain storage challenges, with the sudden surge in demand for vaccines and the specific storage conditions required. The importance of maintaining the cold chain became evident as vaccines were approved. However, in the face of adversity, Africa's resilience shone through. Recognizing the urgency of the situation, the continent rallied together and engaged key partners to help build a solution. Under the Saving Lives and Livelihoods partnership between the Africa CDC and MasterCard Foundation, there was a focus in addressing critical gaps in vaccination and supply and delivery systems. Investments were made to provide proper storage equipment, with approximately 44,000 cold chain equipment procured and deployed across 32 member states, ensuring that vaccines remained potent and ready for administration. One of the key areas of focus for the Saving Lives and Livelihoods initiative was improving cold chain storage. Maintaining vaccines at the right temperature was crucial for their effectiveness, especially in remote regions like Katavi, where infrastructure was lacking.
Inakwenda vizuri. Tunajua sasa hivi watu wameanza kuhamasika.
Ndio. Bana kituo chetu ndio hiki hapo. Cha kutolea huduma ya nini? Ya chanjo.
By August 2023, the Saving Lives and Livelihoods initiative had administered 35 million doses, contributing to the continent's current vaccination rate of 53% of the target population, up from just 3% at the start of the initiative. The initiative continues to contribute towards the building of resilient healthcare systems through collaboration, equity, and inclusivity.
But when they integrate the COVID-19 vaccination campaign and the routine immunizations, we are able now to go beyond the area where there is no health facilities.
Combined with national and local leadership, Ministry of Health and other partners, Tanzania's COVID-19 vaccination coverage has now increased from a mere 1% to an impressive 70% at the start of 2023.
Lakini niwahakikishie Watanzania jitihada tutafanya, wale wote ambao kwa hiari yao wako tayari kuchanja, tutahakikisha chanjo zinapatikana.
By applying a test and learn approach, the initiative aimed to strengthen national health systems across Africa, and the impact was profound. Routine vaccines against polio, measles, and tetanus, once hindered by logistical obstacles, were now also being delivered to the most far-flung regions, finding their way to the very heart of Africa, safeguarding lives. Places like Katavi, where vaccination rates were initially low, are witnessing a change of tide. Tanzania's progress serves as an inspiring example for the rest of Africa and the world as Africa's journey towards strengthening health systems takes flight.